We've all heard of a heart attack, and we've all heard of heart failure. These two cardiovascular events affect hundreds of thousands of Americans every year. But do you know the difference between the two? We sat down with cardiologist Dr. Nitza Alvarez at the Tri-County Heart Institute to find out the difference between these two cardiovascular killers.
The difference between a heart attack and heart failure is that heart attack is a sudden onset of lack of blood flow to your heart. So whenever there is an artery that brings the blood supply to your heart and it gets occluded, and now all of a sudden that part of the heart is not receiving the blood that it needs to feed itself, that part of the heart can suffer damage. That is the simple explanation for a heart attack. Heart failure is the inability of the heart to pump the blood. Patient with heart attack can develop heart failure. You don't have to have a heart attack to have heart failure. But heart failure essentially is the heart is not able to pump the blood properly. There's two types of heart failure. Heart failure that we call systolic heart failure, when your heart is weak. Your doctor tells you, you have a weak heart, your ejection fraction is low. That means that that pump is not able to pump the amount of blood that it needs per minute to be able to supply your body or your organs with the nutrients that it needs. There is a second type of heart failure, which is a diastolic heart failure. This one is mostly the impair and the relaxation of the heart. In order for a pump to be an effective pump, we have to be able to fill with blood and pump out. If you don't have space to fill, you're not going to be an effective pump. So diastolic heart failure is mostly an ability to relax. When the blood is trying to get from your lungs inside the heart to start circulating out, it finds that there's no space. So the blood goes backwards, for lack of a better term, to your lungs, make you feel short of breath, and the presentation is very similar when it comes to clinical presentation. How do I feel? How do I know that I have heart failure? Then the most typical presentation is I'm short of breath or my legs are swollen, which is a sign of heart failure.
You'll find information on Dr. Nitza Alvarez and the Tri-County Heart Institute when you click the Heart to Heart story link icon online at yourhometownhealth.com.